Hey there, Dr. Christianson here. I want to talk about the 8 things your doctor probably won't tell you about Graves' disease, and they're important. So here's the first one, and this is the big one. Graves' disease can be reversed, as in gone, as in forever. And believe it or not, that's the natural course of events with Graves' disease. It's actually a self-limiting condition. So most people, when they're stabilized, this lasts no more than about 18 to 24 months. And then afterwards, it stops all by itself. So you probably didn't hear that part, but it's true. The literature supports that, and that's true for more than 95% of people within that time frame. So with that, it seems like a disconnect that we're so quick to do aggressive, harsh treatments in the modern world. And it really is. So number 2, natural solutions, not only can they work, but they're often more effective than traditional treatments. And traditional meaning really surgery and radioablation. Now, why aren't these things used more? Well, doctors are simply not as aware about the role they can play, and because many natural treatments are non-patentable, there's less incentive to use them. They can't be really controlled or utilized by any one particular company. Big thing your doctor may not tell you, number 3, is that the medications, they can have side effects, and that can be nausea, vomiting, they can be habit forming, they can hurt the bone marrow. There can be some complications with that. And many think that they have to do this long term, and therefore they're forced into doing radioablation or surgery. And the problem with that is just that doctors don't get how to break the cycle. Because once you've broken the cycle and managed your thyroid levels, you're on this time frame of 18 to 24 months. So number 4, you don't have to undergo painful surgery. And in fact, that can be the worst option for some people. That can also raise the risks of parathyroid injury and damage to the recurrent laryngeal nerve. So what does that mean? Well, the parathyroid glands, they control your body's calcium metabolism. And that's super critical for good bone health, for cardiac function, for normal nerve conduction. And they can be affected and removed inadvertently by thyroidectomy surgery. The other big complication is to the recurrent laryngeal nerve. I'm using that one right now in order to speak to you. It's the one that connects my brain and my tongue. And it happens to pass through the thyroid to get there. So the drawback about that nerve being damaged, well, you can't speak properly, or swallowing becomes difficult. And the last big complication to think about is just long-term hypothyroidism. So the gland is gone, and so they are really locked into therapies long-term. The 5th thing you may not hear is that foods can aggravate Graves' symptoms. And many people are just going around on a day-to-day basis eating these common triggers and not knowing why the symptoms are getting worse. The 6th big one is that Graves' disease is much more common in women than men. And it's a genetic condition. So like all autoimmune disease, genes can trigger it. And the same ones that can trigger it can also trigger thyroid cancer or Hashimoto's thyroiditis. So in a family, for example, some people may have hypothyroidism, some may have Graves, some may have Hashimoto's, but it's that same susceptibility. And this plays out 6 to 8 times more commonly in women than men. And by really understanding the core causes, including the genes, and acting in ways to work around that, that's the steps that help move you towards that reset process. Number 7, radioactive iodine, most common treatment in the US. It's not just a quick fix. It may take months to be effective, and it may require repeat doses. The other consideration is that there are side effects such as longer-term risks of head and neck cancer, colorectal cancer, and laryngeal nerve damage. So serious things to think about. The last big one, it's not my temperament to think about, anyone having bad intentions or there being conspiracies. I don't believe in things like that. But it's not a secret that there are economic incentives to do more aggressive treatments, such as surgery or radioablation. So it's quite simple that in medical reimbursements, insurance and Medicare, doctors receive more for that than they would ever receive by just managing patients for a period of 18 to 24 months to reverse them. And that does change how treatments work. So much of the rest of the world does not rely upon these dramatic, non-reversible type treatments. And part of it is because of these passive economic incentives. We know that they do change treatment options. They do just shift what occurs in medicine. So it's got to be acknowledged and got to be owned. The incentives do drive the policies. And the important message is that Graves really is reversible. You know, in the course of a short period of time, you can have this behind you and be functioning your best again. And that's what I really want to see happen. Dr. Christianson here, and take great care of yourself.